started. Respect everybody's time. We're 2 minutes past the hour. Cody, you can hear me okay? All right.
You got it.
So we've got our partners from MSU and Bozeman Health with us today. I'll go through the surveillance report, and then I'll have some information I want to share with regard to some of our local health officer orders related to mask use, and then throw it to our partners, and then we'll take questions, if that's okay with everybody. Ooh, I need to be able to share, whoever's controlling this thing.
Holly, are you able to do that?
There we go.
Yep.
Okay, can you all still hear me? Okay, so here's our weekly surveillance report. You can see we continue to see a reduction in the number of cases per 100,000. We're now down to about 13 and a half cases per day per 100,000. That's about a 20% decrease from where we were a week ago. That's good. We want that trend to continue. Just importantly, and we'll talk about this more in a minute, a threshold that the Board of Health has established and public health authorities have established is important, is 25 cases per 100,000. We have been under 25 cases per 100,000 for almost 2 weeks now. On Monday, we'll hit 2 weeks, 14 days. And that's a specific criteria that's set in Board of Health rules related to COVID-19. Our case positivity rate also is trending downward. We haven't gotten it under 5%, but it's at 6.8% as of the 11th. That's good. That's down a full percentage point from the last time we visited a week ago at this point in time. It's below 10%. That's the red line you see right there. We'd like to see that below 5%, but it's good that it's trending downward, and we're hoping that continues. Testing continues to be in good shape. We're getting test results back, lickety split. It's not taking much time. And you can see we're getting investigations started within a day or even less from the time when we're getting those reports of cases, which shows our contact tracing is doing okay. There's the onset date epi curve. You can see that bump after spring break, and we seem to have fewer people testing positive and fewer people, you can see the reflection in the onset date. Again, you can see, a bit of a leveling off in the 20-something age category and the number of cases that we're seeing. Still over cumulatively, looks like roughly twice as many cases as any other age group in that 20-something age decade. As one would expect, we're seeing much less activity at MSU now that the spring session is out. We had 3 cases during the last reporting period. That continues, that's about the same as we had been, but it's pretty darn low. And it's really not comparable to where we were earlier in the year, as your MSU is no longer in session. Don't have a graphic for the hospital. I can tell you, and I'm sure Kallie will expand on this. We get the census report on a regular basis. The hospital continues to look like we're in good shape in terms of the number of people. I think we had 4 or 5 COVID patients as of this morning. None of them were in intensive care, and that's a good thing. Continue to see cases in schools, in school settings. Again, a lot of those youngsters are not yet eligible for the vaccine. And generally kids do pretty well with it. They do contract it, they do spread it. And then the concern there is that it can be a spreader in the community. And we do have a couple cases in long-term care facilities, but we're working with those facilities to limit that spread right now. So, overall, in general, we're really glad to see these case numbers continue to come down. As I've said many times in the past, this is a numbers game. If we can keep these case numbers down, you can keep hospitalization numbers down usually. And when you keep case numbers and hospitalizations down, you keep mortality down. And so I think those things are all important. Can you all still hear me okay? So based on that, we have been, as you all know, the Board of Health and has been working with me and the community. Yesterday, the CDC also came out with some new guidance related to individuals that states that individuals who are fully vaccinated, meaning they're 2 weeks past their final shot, no longer need to wear masks in many settings. So based on that guidance and our own improving epidemiology, I'm planning to sign a document later on today rescinding a health officer order related to face coverings. Again, as I said, the decision is based on a number of factors. One is that CDC guidance. Again, the CDC coming out yesterday and saying if you have had 2 doses of Pfizer and you're 2 weeks past that, if you've had 2 doses of Moderna and you're 2 weeks past that, if you've had 1 dose of Johnson & Johnson, you're 2 weeks past that, you're considered fully vaccinated. You no longer need to wear masks in many settings. It won't say in all settings. In many settings, you don't have to wear that mask. The other thing that really factors into this is our own improving epidemiology here locally. It really has opened up the possibility to do this. These are areas that have been consistently identified by the board as important to decision-making, including that reduction in the number of cases, which helps us reduce hospitalizations and helps us keep the number of deaths low. We have adequate capacity in the hospital, and the hospital is able to deal with people who need care, whether that's COVID or not non-COVID. We've seen that for quite some time now. And we've seen adequate, really good, actually timely turnaround when people do get tested to be able to get those test results back. The positivity rates among those who are tested are still above 5%. That's a little higher than we'd like to see it, but they've been coming down, and we're hopeful that they'll continue to come down. Maybe most importantly, those tests are available to anybody who needs them, and when people do get tested, those are coming back quickly. The third factor is we now, and for quite some time, we've had enough vaccine and resources to dispense that vaccine to anyone who's older than 16 or older. As of now, I mean, most people who are 16 and older have had the opportunity to get the vaccine if they want it, and not only get their first shot, but get their second shot and move 2 weeks past their second shot. We understand there are still some people in that process, and we need people to continue to get those vaccines. But there has been ample opportunity for people to access the vaccine over the course of the last 3 months for everybody who's 16 and older. So that's another factor. You know, the Board of Health has always been clear about basing the decision on the best public health guidance available and our local epidemiology. And we're at a point in time now where that guidance and the epidemiology are colliding to allow us to make this decision. And so based on those factors, now is the time to move past those requirements from the health department to allow organizations and individuals to make decisions based on the best Centers for Disease Control guidance available. I want to stress, this does not mean the pandemic is over. It does not give anyone the right to ignore policies and rules put in place by businesses and other organizations. The CDC continues to recommend mask use in certain settings, especially for those who haven't been vaccinated. And some of those settings include schools, healthcare facilities, congregate settings such as correctional facilities. We need everybody to respect the internal policies of businesses, of healthcare facilities, of school settings, of government facilities that are going to be making decisions based on their own internal risk factors as well as their guidance. The health department is going to put its energy into helping those organizations interpret that guidance and implement policies based on that guidance, but we're no longer going to be requiring that people wear face coverings in public settings. Although it is within the right and probably is responsible for some organizations to continue to do that. The virus is still dangerous, especially for people who are not vaccinated. And so we recommend that all organizations continue to follow that CDC guidance and we urge all individuals to respect and follow those decisions. We will get back to normal if people keep getting vaccinated and if we work together to limit transmission in those higher risk settings. I want to repeat that. We will get back to normal if people keep getting vaccinated and if we work together to limit transmission in those higher risk settings. The Board of Health has always worked, again, like I said, to base its decision on that local epidemiology. The things that are really informing that right now, that 7-day average of daily cases per 100,000 is now well below 25 cases per day. On Monday, we'll hit the 2-week mark for that. That's an important threshold. Hospitalizations have been low and testing capacity is good. I made this decision as health officer after consultation with the Board of Health, the county attorney's office, school officials, healthcare partners, and elected officials. So I'll be signing that probably right after this press call. And we'll be putting out a press release announcing that, and we'll be updating our website to get people directed to resources to help better to see the CDC guidance and to make decisions independently for their own organizations. I'll take questions about all that in a minute. I want to give Kallie and Tracy a chance. I think we did Kallie first last time. Tracy, do you have anything to add to that?
So we are really transitioning into this summer period where we're trying to encourage and incentivize students who have not yet been vaccinated to get vaccinated. With the help of the Montana Department of Public Health and Human Services, we were able to roll out an incentive program yesterday for students where if they get a vaccine, they can show the evidence of their vaccine and get a $10 gift certificate. And then we'll be messaging over the summer to students who are not here on campus to urge them to use the summer as an opportunity to get a vaccine if they haven't already gotten one for the return to fall. And I think that we still have vaccine clinics here for students on campus. We have the capacity to do 70 students a day, and our Monday clinic has 75 appointments scheduled. I'm sorry, 65 appointments scheduled. So we're still seeing students come and get vaccinated, and that's great news. I think that's all I have, Matt. Thanks.
Thanks, Tracy. Kallie?
Yeah, thanks, Matt. So Bozeman Health is now offering the Pfizer COVID-19 vaccine to all individuals over the age of 12. I think it's important for us to reiterate that. I know I said that last week as well, that we would be offering it, but it's important for people to understand that we are doing that as of right now. The sign-up process to schedule anyone over the age of 12 is through a COVID vaccine appointment online. Parents can use the online links to schedule a vaccine administration appointment for their child as well. And that goes for both Bozeman and Belgrade. And that is at bozemanhealth.org/vaccine. And then the COVID vaccine clinics at Deaconess Hospital is moving. We've been doing it in our main hospital at entrance 1. It is going to be moving to entrance 4, which is across the parking lot and the campus from the, it'll be across from the emergency department at entrance 4. And that will be as of Monday, May 17th. So important for people to note that as well. And then I do want to make a comment about masking as well and face covering for the safety of our patients and our visitors and our employees. With that being our #1 priority, we as a healthcare organization are required to follow CDC guidelines in regards to all of the infection prevention practices that we follow here. The CDC recommendations at this time are to continue to wear face coverings at all of our care sites. And this is because we cannot track those who are immunized and those who are not against the COVID-19 virus. So face coverings will still be required while inside all of our Bozeman healthcare sites. And I wanted to take a moment to reiterate that. I don't have any further updates at this point in time, so I'll open it up to you, Matt.
Thanks. I would stress that not only healthcare institutions, but I think there will be some schools. I've talked to a number of school superintendents, have large numbers of people who are in those buildings who are not vaccinated, long-term care facilities, nursing homes, assisted living centers. If organizations, it's going to be very difficult for some organizations to understand and determine who is vaccinated and who is not vaccinated. And in those cases, it may be reasonable and expected that they require everybody to wear a mask. And that includes some businesses. And so we really need people to respect that and understand that. And that if just because you're vaccinated or just because this rule doesn't exist does not give you the right to just decide to wear a mask where and when you want. If you're in a business, if you're visiting an organization, if you're going to a school, you're still required to follow the rules and the policies of those organizations. They still have that authority. And frankly, they have that responsibility to be able to do that and protect the people that they're serving. I think we have at this point in time, just a little over 40% of our population, of our eligible population, about a little over 42% of our eligible population is fully vaccinated. That's great, but it's not even half of the eligible population, and we're not even counting in all the kids that are out there. There's still a significant number of people out in our community who are not vaccinated, and this virus continues to circulate, and we continue to lose hundreds of people a day in the United States to this virus. That said, I think the steps that the CDC took yesterday were important. There's an important move toward finding a path toward a more normal summer. But we want to stress, we need people to keep getting those shots. We need people who have not been vaccinated to really consider being vaccinated. I think this really speaks to the CDC's confidence in the effectiveness and the safety of these vaccines. That if people get vaccines, they can really reduce their risk, not only for themselves, but for the people around them. So with that, I will throw it open to questions.
Hey, Matt, Cody from obviously KBCK. I put it like a big sore thumb right on my name every time now, but you know me. Just for the document that you're signing, is that effective immediately?
Yeah, it'll be effective today.
And you kind of already answered my question with this. So a lot of this might be redundant, but just I sensed a little bit of weight. And obviously, I mean, it's been a long time coming. Just from your perspective, to get to this point and to hear the CDC's news this week, what's that like for you in the health department and I know you've stressed that obviously this isn't over, but what's it like for you to make it here? It's been a while.
It's been a while, and this particular issue has been, as everybody knows, pretty contentious and pretty difficult. And I think it's good. It feels good that we have gotten to this point, and not only it's happening, that the CDC guidance is coming at a point in time when our local epidemiology is coming to a point where we would have been considering doing this anyhow. When I think back to where we were in late October and early November, there were some days we were getting hundreds of cases. Our case positivity was over 20%. We were seeing, we were completely overrun in terms of our ability to do contact tracing, hospitalizations. We had dozens of people in the hospital, including many in critical care. That was a point in time when the board looked at those metrics and they looked at the CDC guidance and they said, we're putting in place some more restrictive measures. As those case numbers came down, consistently as the board has met, they have worked to take down those rules as the epidemiology has allowed them to do that. And so now on Monday, I'm pretty sure we're going to get to a point where we've hit that threshold of 2 weeks under 25 cases per day. Maybe the most important one is that we're not seeing large numbers of people in the hospital. And I think the high percentage of people in those older age categories who have gotten the shot. Still nervous though. I still think that when you look across the globe, you can see places like Israel and the United Kingdom with have done a really good job of getting their population vaccinated, are really seeing the bottom drop out of the number of cases that they have, particularly Israel. If you look at Israel, they've done a really nice job getting people vaccinated, and they used to have thousands of cases a day, and they're down to fewer than 100, I think. They have done a great job getting people vaccinated, and they're reaping the rewards for that. Their businesses are open, they're moving forward. At the same time, you look at places like Brazil, you look at other places that maybe got the vaccine later, they've seen the variant spreading pretty rapidly and widely. They're in a much different circumstance. And so it's going to continue to be really important that we continue to get people vaccinated, because if we stall out and we have half of our population that's still vulnerable to this virus, it does two things. Number one, it makes it so that they are more likely to get sick, that their risk is higher. But every time that virus is transmitted, and as long as that virus is allowed to circulate in the community, there's more risk that it's going to mutate and we're going to get another variant that then could become resistant or less affected by the vaccines that we do have. So we really need people to keep getting that shot. That's where we're going to be putting our energy and resources in the weeks and months ahead, is really making that vaccine available, listening to people and trying to make sure that they're comfortable with that, and then presenting them with an opportunity to do that. It's really important people keep getting those shots.
You answered my follow-up question in that same nugget, so I'm good now.
All right. Thanks.
You. You got her.
Hey, Matt, Nora with the Chronicle.
Hi, Nora.
Hey, I was wondering, can you talk about like where you would recommend people still wear masks, both vaccinated and unvaccinated people?
So we're going to be putting up on our website the CDC guidance. For unvaccinated people, the CDC continues to recommend wearing a face covering in indoor public settings. For me, what I really think about it, if you're not vaccinated and you're in an indoor public setting, you really want to have a face covering on to protect yourself and to protect those around you. I don't think they're necessary in outdoor settings in most circumstances, unless it's a really crowded setting. And then, of course, the things that we've been talking about in those areas where there are sensitive groups and large numbers of people who are unvaccinated. So K-12 schools, healthcare facilities, congregate settings, correctional facilities are the kinds of places. It really lays it out in the CDC guidance that's out there. And then, when there is a business that has made a determination that they're more comfortable with their customers in masks, based on whatever they want to base that on, maybe they have people who are their employees who are sensitive, or maybe the owners are sensitive, maybe they serve a clientele that is at higher risk. We really need people to honor that and to really respect that. It's not going to be the county saying that anymore, or the health department or the Board of Health saying that anymore, but we all need to work together and really respect the decisions that are going to be made by those individuals and those organizations.
Okay, gotcha. And I was wondering, I guess I could maybe wait till the press release, but I wanted to ask about what exactly is being you're signing on. Is it the health officer order, the Board of Health mandate that I think the date was like the 27th or something? But yeah.
It's a good question. I have the authority to rescind the health officer order, which mirrors the Board of Health rule. As you all know, the Board of Health rule is out there. It expires on May 27th. It takes a meeting, a publicly noticed meeting. At this point in time, it's going to take us probably a week. It would take us probably a week to get that together. I've talked to the board chair and vice chair. I've talked to the county attorney. Our attitude on the board rule is it's still there. We're going to be devoting no resources to enforcing it. We're going to be putting our efforts into helping people understand that CDC guidance. And I fully expect that rule to expire on May 27th when the expiration date hits. The bottom line is we want people to follow the CDC guidance, and we're going to be putting our energies into that rather than enforcing the board rule. think the board members and the county commission and the county attorney are comfortable with that.
Gotcha. Okay. And the last thing I'll ask, talked a bit about, looking towards the summer. I guess it's in a few weeks now. But I'm wondering kind of how you feel about how it might go this summer as tourist season kind of picks up here, considering the vaccination rates and, the mask news.
Well, it really depends on if people keep getting vaccinated, how I'll feel about it. If we can keep getting people coming in and getting shots, or being willing to get the shots and get our vaccine and keep our vaccination rates growing, we've seen the impact that has had in our case numbers and our hospitalizations. If we as a country, as a community, as a state, if we stall out and we continue to have large numbers of people who are unvaccinated and vulnerable to the disease, we run the risks of the things that I talked about before, not only of having people get sick and hospitalized, but on the virus spreading and mutating and creating a bigger problem for all of us. Other questions? Okay, I hope everyone gets outside, enjoys the nice weather, and enjoys the weekend. I appreciate your time. We'll be putting out, as I think Whitney or Holly mentioned, we'll be putting out a press release delineating a lot of what I just said, as well as updating our website to point it toward that CDC guidance. And we'll continue to be working with organizations and individuals to understand that.
Excellent.
All right, thank you all. Have a good day.
Thanks, everybody.
Thank you.